Good day, these great surgeons miss you all a lot, and by now, never waste your time in a topics that doesn't exist in the exam except for one or two questions, like the statics and embryology. And always remember that we have pillar topics in the exam. First and second and third will be the anatomy. About 75 questions are pure anatomy, as well as trauma, orthopedics, preoperative and postoperative. Those are the main pillar of the exam. Otherwise, you will be surprised inside the exam that it's likely to be orthopedic exam, not general surgery exam. In fact, it's anatomy, trauma, orthopedics, preoperative and postoperative care exam. So take care. And this makes you calm inside yourself, not to panic at all, because it will guide you that you don't have to do sophisticated doctorate on the mystical questions that have been bothering all you by now, but to focus on the main bulk of the exam according to the exam mark distribution. Play smart, not hard. You have been doing the hard work required by you already by then. And a brief reminder that we have at least 50 questions in a different topics that are a must in the exam. You will be asked in the anatomy about the dermatomes, lymphatics, nerve injuries, vertebral levels, and the foramen of the skull, and of course, embryology. And by the way, the embryology will be the common of the common must question from the embryology to be known, not the extremes, except for one question. So don't drain your power by now on one seldom question. And you will be asked a question about the ABG, electrolyte imbalance, and Glasgow Coma scale, as well as ECG. The ECG will be the common of the common. He will not track you this much about this question, but you have to be ready. And of course, the vitamins and how come MRCS exam exists without asking about the vitamins and the Sayada disturbance and its differential diagnosis. It's all about the electrolyte imbalance, not far, as well as some questions about the respiratory function. And regarding the pathology, you will be asked about the wound management, which is overlapping with every chapter, even the ATLS protocols, as well as the fracture pattern is a must, pediatric orthopedic is a must, congenital GIT disturbance was a must pathology, and overlapping with every topic. And of course, a burn equation. There will be a statics question, and believe me, it will be known, as well as a consent and audit topic. If you master those topics, you're having at least 160 common questions in your pocket in the exam. Those are other than the records. Those are not just hypotheses. It's not Bishow's exclamation. It's the Royal College official mark distribution you have to keep in mind. Those questions are a must in the exam, and you have to keep them in your pocket while entering MRCS exam. So you have to stress on the topics that you know that you have points to improve on those topics, especially from your own self notes. But keep those topics in mind. This is how you manage your time by now. You keep these topics in mind as well as improving every point require improvement with yourself. And if you are hearing this by your revision, so keep scrolling. Fast reading is your key. And never fear anything. It's the adrenaline inside you that is driving you from fear or fight. So keep it always on a fight mode. You are now ready to receive every idea that pass by your eyes. That's why scroll with peace and trust in God. Do your best and leave for Him the rest. Take care. May God bless all your efforts with joyful success. Together we can, with the grace of God.